more information on high blood pressure.
We're thinking of having another child and we want to know the risks of high blood pressure.
Well, you came to the right place. Tell me about your family history.
Certainly. My family has had no history of genetic disorders, but my grandfather and father both had high blood pressure.
I see. Now, what is your ethnicity?
I am Native American.
Okay. What of your history, miss?
I'm Hispanic and Latino, and my family has no history of genetic disorder. None of my relatives have had high blood pressure, and that I know of. However, I did have gestational diabetes when I was pregnant with my son.
Do either of you suffer from high blood pressure? And what of your age?
Neither of us have high blood pressure.
I am 23 years old, and she is 21.
Okay then, let me tell you a bit about high blood pressure. High blood pressure is when your heart is working harder to pump your blood. When high blood pressure is measured, it tells how hard your heart is working to pump your blood. Hypertension, also called high blood pressure, is a multifactorial disease. This means that it is influenced by many environmental factors and some genetic factors.
I don't understand.
It means that your potential child could receive high blood pressure because you could pass on the gene to your child, or that your child could be eating bad foods that make it have high blood pressure. It really depends on a lot of different things.
Would our child have a higher risk because his grandfather had high blood pressure?
I cannot say for sure whether your child will get high blood pressure. The child would certainly have a higher risk because high blood pressure runs in your family, but there are other factors as well. Here is a list of factors that give you a higher risk of hypertension.
You have a higher risk if you are African American or Native American.
Also, if you smoke or are obese, stressed, or eat too much salt.
Look here, it says that you have a higher risk if you have a family history of high blood pressure or have diabetes.
I will also mention that Latinos have a high risk of diabetes. And didn't you have gestational diabetes during your pregnancy?
Yes, I did. We were hoping for a girl. Doesn't high blood pressure appear more often in men?
Yes, high blood pressure does seem to appear more often in men, but that doesn't mean that women do not get it. You can't count on getting a girl either. There's always a 50% chance that you'll get a boy. High blood pressure doesn't always appear right away. Many times it is diagnosed later in life, so you or your son could still get high blood pressure.
How would hypertension affect my lifestyle?
What are the symptoms of high blood pressure? What are the dangers?
High blood pressure is known as the silent killer. People don't show symptoms until their blood pressure is really high, or if they had high blood pressure for a long time. They need to measure their blood pressure to see if they have high blood pressure. The symptoms of high blood pressure include confusion, dizziness, nausea and vomiting, chest pain, shortness of breath, ear noise or buzzing, tiredness, headache, irregular heartbeat, nosebleed, and vision changes. If you experience any of these symptoms, you need to see your doctor right away. If high blood pressure is not treated, there are serious problems it could lead to. Complications of high blood pressure include heart disease, brain and artery damage, kidney failure, stroke, and eye problems.
How can it be treated?
Although there is no cure for high blood pressure, there are several things you can do to reduce your high blood pressure. One thing you can do is eat a healthy diet. You can also do regular amounts of physical activity. Also try and limit the amount of alcohol and salt in your diet, and avoid smoking. For more information, you can visit the American Heart Association website.
What would your advice be? Should we have another child?
I cannot answer that. It is entirely up to you. Here's a brochure on where you can find more information on high blood pressure. There are also some support groups. Daily Strength is a popular support group. Also, the PubMed Health and eMedicine Health websites have good information, and the National Heart, Lung, and Blood Institute is a good source of information.
Thank you so much.
Glad it could help. Have a good day.